It is most common for infection to occur in the early post-operative period, so it's really important to be vigilant there. And if patients show sign of infection, it is important that they are referred promptly back to the operating team.
My then husband called the doctor, GP come out, literally took one look at my hip and said, no, you need hospital and you need to go now. And took me, and the ambulance turned up, and as I said, I was taken to French. And obviously they then do the blood tests to look at your infection level, and mine was sky high.
The reason it's important to treat it promptly is that bacteria form something called a biofilm, which is a protective shield around them where it's much more difficult for antibiotics to penetrate and much more difficult for the body's natural defense mechanisms to penetrate. So it would be important for us to try to treat it prior to the biofilm forming.
You couldn't get out of bed. You'd been awake all night with a pain in your hip. You couldn't get out of bed. I rang the doctor and the doctor came, and then you were taken to the hospital.
Yeah, not being able to get out of bed, and the doctor came and got me to the hospital, yes.
So patients who do, unfortunately, get an infected joint replacement, their outcomes will be different, their surgery journey will be different, their amount of surgeries will be different, but the really, really important thing is early access, early identification, early assessment.
Because speed is important at this point, isn't it?
Exactly. So if there is a suspicion of infection, then it's important that that person is seen and evaluated by the specialist team quickly.
If there is a referral for a patient who may have an infection who turns out not to have an infection, that's far preferable than a patient who may have an infection that isn't treated promptly and then does have an infection.
What I would say is if you've got that niggle and you think just the slightest, if you're really unsure, go back to the hospital and get it checked.
What's really important in treating the infection is to try to identify which organism is responsible for the infection and which antibiotic would be best in treating that organism. So in order to do this, we try to get really good samples from deep within the infected tissue. If you give broad spectrum general antibiotics in the community, what usually happens is that it dampens down the bacteria but doesn't necessarily eradicate it. Then when we take our samples, the bacteria doesn't grow, and so we never know for sure what's the exact organism or what are the best antibiotics to treat it.
It's really important not to be treating these infections by yourself in the community. You're going to need the input of the specialist orthopaedic team urgently.
Because at the end of the day, like I said, if I'd gone sooner, the infection wouldn't have gone as deep as it did, which wouldn't have led to all the operations.